get this question a lot, particularly when we're meeting with a mom for the first time and we have to give them bad news, potentially, that their child has a heart defect. And almost always, it's unrelated to what the mother does during pregnancy. Okay, there are some very loose associations between smoking and alcohol use during pregnancy and minor heart defects. On occasion, we see mothers with who've had gestational diabetes or typical normal type 1 or type 2 diabetes whose babies will be born with a little bit of thickening in the heart or with these VSDs. And almost always that resolves, both the VSDs and the thickening of the heart. So when we're talking about serious heart defects, there's nothing that we've been able to identify that can blame the mom. And of course, there's that maternal guilt, this feeling of, I must have done something wrong because my neighbor or my friend didn't have to go through this, and that's just not true.
Yeah. Are there some medications that sometimes could be increasing the risk of heart problems during fetal development?
There are some, and there's a lot of the medication approval, at least in the United States, is very rigorous to try and avoid and identify medications that can put fetuses at risk for defects, not just heart defects, but other types of defects. And there are some medications that can be associated with heart defects. One of them is called warfarin, which is a blood-thinning medicine, which, when used early in pregnancy, can cause some heart defects, but it can be safer later in pregnancy. There are some others related to seizure-type of medications, treatments of seizures and neurologic disorders that can be associated with heart defects. So I think it's important, if you're pregnant or considering pregnancy and you're on medications or being recommended medications, that you ask those questions to your doctor to make sure that there's a low risk or no risk of harm to the fetus. There are great resources these days online. When I have a question, I type it into one of any number of online resources to look at what the risks are for certain medications and harm to the fetus.
Okay. You just mentioned resources, online resources. Do you have any good resources for families that have congenital heart disease in running their family or with their child that you feel like are very accurate and reliable sources of information?
I think that there's always the risk of just Googling things, and you get a lot of times, unfortunately, the worst stories that are out there and the scariest stories that are out there. I think the best resource, I'll be completely honest, is your physician. Whether it's your primary physician or your cardiologist, because they're going to have the most up-to-date information. They're going to have a good context of what advice they can give. They're going to understand your child's heart defect more specifically, because even though we give names to a lot of different defects, there are nuances and there are subtle variations from one child to the next, and we don't want to sort of paint broad strokes and mislead people too much. But those are good resources. I also would stick to resources that are backed by the American Heart Association, American College of Cardiology, ones that are supported by physicians, because they will provide some medical insight. I think parent support groups are very good as well. But I would stay away from kind of these, I heard on the internet or I read this thing on CNN, because those are typically very much isolated cases that may not reflect your child's heart disease. I have a long answer, so if you had a shorter one, you can go into
Your answer is probably more interesting. Why
I don't know. We'll see. How long do we have? How long is this thing? So I knew I wanted to go into medicine when I was a little child. In fact, I remember this story has been told over and over by my parents, where we're in a car driving somewhere, and I grew up with 4 siblings, and I think my older brother got sick and threw up. This is kind of disgusting, so I apologize about this. And I was so fascinated by it. I must have been 3 years old, but I could not keep my eyes over it. My dad will, kind of reenact me sort of with the dry heaves, but just so fascinated by this body process that was every other kid would just get disgusted by. I don't know what that means about me, but from that point, my parents said they knew that I was going to be a doctor. And I always loved kids. I always liked working with kids, and so I kind of knew early on I wanted to go into pediatrics. What directed me to pediatric cardiology was I was living overseas in Russia, actually, and I was working in a city outside of Moscow, and I met a lady who we would kind of go door to door and meet people, and she invited us in, and we were talking to her, and she showed us her child, a daughter, who was, I think, about 9 months old, and she asked me, I was young at the time, this was before medical school, she asked me how old I thought her daughter was, and I looked at this child and she was small, and she was kind of had a ruddy skin color and very thin, and I thought she was 4 or 6 months old, and much younger than she really was. And she explained that her child had a heart defect, and I didn't know what type of heart defect. I couldn't understand that. But that stuck with me, and actually over the course of our interaction with this nice lady, her daughter died because of her heart disease, and they had prior to that been taking her up to Moscow, which was a 12-hour train ride every month to get medicine, and I obviously didn't help her, and I didn't know much about medicine at all at that point, but in my mind it made sense that if they had had the resources that they needed, she should have lived longer, and I found that to be true, that in general there are bad heart defects out there, but if a child can live to 9 months old without the optimal care, they should be able to live longer with better care. And so that stuck in my head as I went to medical school, and I was trying to make a decision. Do I want to do this? Do I want to do that? In my mind, I was like, no, I need to be a pediatric cardiologist. I need to go back to Russia, and I need to help provide this this service as much as possible. And so I came to Mayo Clinic very fortuitously, and shortly after coming here, I found out that the chair of the division of pediatric cardiology travels to Russia every year. And so I thought, well, that's great. This is when I was here for pediatric residency, and so I stayed for my fellowship training in cardiology. And my first year of fellowship training, I had the opportunity to go to Russia, and I've been every year since then. And so that's kind of, it's really, for me, very gratifying to do something that I love doing and feel like I'm able to kind of contribute back and sort of bring full circle this impression that I had when I was 20 years old. So anyway, that's my long answer. Sorry about that.
I don't know if I can top that. We're following up. Do we have any other questions come in, or should I share mine?
Nope, go ahead and share yours.
Okay. Mine isn't really that interesting, and I just had some personal medical experiences in college and stuff, and a couple surgeries that really made me interested in pursuing medicine. And then once I got into medical school, I found pediatrics to just light a fire in me, and I found that I really don't have to grow up a whole lot. I can still be a kid. Even with the sickest children that you're trying to help and stuff like that, there's still there's joy, and there's so much hope for both them, and they really center you and ground you. I feel like, I know it's a super cheesy answer, but it's fun. Every day you get to go to work and you get to smile and stuff and play with the kids. So.
And I think that's exactly right. I have there are the highest highs, there are lows, obviously, when you're dealing with sick kids who you've seen a lot and you care about very much, and they don't do well, and that happens, and that unfortunately is still just part of medicine and taking care of kids with for me with serious heart defects. But then just the joy of seeing kids recover and get better and grow up, and you see them when they're young and you see them when they're going to college, and it's I don't know, there are a lot of doctors who just are not interested in taking care of kids, but those of us who enjoy it, it's very fulfilling. Very fulfilling.